And then this patient comes to you with this diagnosis of Morton neuroma. So what are the tests that you do, clinical tests and signs that you are looking to assess and diagnosing these conditions?
And hopefully they come to me. It's been a lot of legwork so far. Even I think it's maybe just been 3-4 years now, and I think most recent count is close to maybe 20 patients or something like that. So not a huge number of patients are really rolling in, even though it's been a lot of reaching out to very specific podiatrists for referrals. But hopefully the patient comes into us, and in the clinical exam is pretty straightforward, pretty typical. Trying to establish patient rapport through history taking, find out my information that confirms. I have like an Epic system that links with the hospital that we work with, so I can get a lot of the basic background information, but mostly just kind of confirming a lot of that information, and then also trying to get and feel out the patient a little bit as far as what their fears are, some of their worries are, their concerns with the rehab. Trying to find hopefully strings to pull later on as I'm establishing that therapeutic alliance. And then, once we get through the history, which, most often it's pretty typical, weight bearing type pain. Although you find curveballs and you shouldn't see things like pain with rest, which happens maybe in a really inflamed presentation, or also, if there's that inflammatory component, or if there's also something else going on, as you saw in the paper, as you refer to as a joint derangement that may or may not respond to repeated movements. And then, after getting through that characteristic history, taking a look at the movement exam. So getting a little bit closer to the foot than maybe I would have normally otherwise before starting to see these patients a little bit more often. And looking at toe extension, flexion, range of motion, pretty typical. Maybe you look at strength around the ankle, and then getting into a repeated movements exam, looking at, after clinical tests, of course, to establish baselines. But looking at repeated movements exam is kind of the primary component of the examination.